All right. Well, welcome everybody. I am so excited to introduce Andrew Demaray. He's a senior business analyst for the Oregon One Eligibility Program. His colleague James Sparta is joining us today, and he came and presented to the ORN Leadership Summit about this program, and I thought that it would be something that would be of use to all of you. So here we are today. Um, I will have a certificate process for you at the end to count your attendance. And with that, I'm going to pass it on to Andrew.
Hi, everybody. So yeah, I will be going through a live demonstration of our one online portal, the public-facing side of our
Andrew,
portal.
we
Yep.
can barely hear you.
Oh no. No. Uh-oh. This is working.
You're doing great now.
Now.
There you are.
We did
no.
test this ahead of time.
Good. Okay. Well, apologies about that. So yeah, I will be doing a live presentation of our one online portal, the public's facing side of our portal. It's where individuals can apply for a number of different benefits offered by ODHS. We're going to start by showing how to create accounts, and then we'll go through the process of completing an application. And once we get through that, talk about managing benefits and tools that we have for that in this system. So first of all, just a little bit of disclaimer here. We'll be using a testing environment, which does mirror our live environment exactly. Sometimes things run slightly slower, so it's not entirely indicative of the speed that everything goes in our live system. Sometimes there might be a little bit of slowness. And then in addition to that, I will mostly be looking at things from kind of a technical and process sort of aspect. I do have some experience in policy and all of these things, but that is slightly outdated. So I'll do my best to answer questions, but it's going to be mostly focused on the general process of applying for benefits rather than the specific details of approvals and denials and things like that. Just going to refresh our page here, and then this is the landing page that an individual would reach when coming to us to apply for benefits online. And we'll go ahead and click apply now down here. And I'll start by showing what it looks like when we create an online account for someone who has an existing case in our system, someone who may have been approved through a local office or over the phone, but not having applied themselves. So I'm going to actually also zoom in a little bit so it makes it easier to see. On this page here, we have two options. We can create an account for an individual or for an authorized representative. We'll talk a little bit more about what an authorized representative here is in just a moment, but we'll start by creating an individual. So after putting in a username and password, as well as the email address, we will click submit. And then that's going to generate a email verification to verify that email address. So to finish setting up our account, check our email. We'll send an email confirmation link. So to do that, we'll go to the email that I'm using here. And what we see here is slightly different than what would happen in our live system. It would not be this series of links. There would just be a single link to return back and verify our email address. In our testing environment, this is the process that we use. So step 1 is complete. We verified our email. Click step 2 to continue. And we'll go ahead and log in with that login that we just created and the password we created. And then it's going to take us after this warning screen, which just talks about internet activity being tracked. If we're in public in an abusive relationship using a computer at a local library or friend's house, information can be tracked. So just be aware of that. Talking about the website is property of the state of Oregon. User verification process. So this is making sure we are who we say we are. So we're going to complete this information here. Another captcha here. It's trying to verify the address I put in. Apologies for the delay.
So this is, Andrew, this is unique to the training environment, how these delays.
What, excuse me?
Oh, is this something that people can expect, these kinds of delays, or is this unique to the training environment?
So typically it shouldn't take quite that long, but what the system was doing there was we use a service called Melissa that verifies the address that we put in, if it's a valid address recognized by the Postal Service. If not, you can choose to proceed with the address as entered, or it will give you the suggested Postal Service address. So that's what it was doing. It doesn't typically take that long for it to pop up there. And then once this screen is completed, it'll take us to the RIDP process, which is remote identity proofing. This is information pulled from credit reports through Experian. And folks may be familiar with this. It'll usually pull up like you lived on one of these 4 addresses, or you drove this kind of car. So these are just mock answers that have been thrown into our system. But this is essentially what a user would see, but it would be their information populated from Experian. And so we've successfully identified or verified our identity. So we'll click next. And yeah, this is running slightly slower than I would expect in the live system. So just bear with me as we're waiting for these pages to load. And yeah, as James said, feel free to drop questions in the chat and we'll try and answer as we have these pauses here. So as mentioned, that was creating an online account for an individual who had already had benefits in our system, but did not have an online account yet. So first thing we get to here is if we'd like to go paperless. I'm going to choose no thanks, just to get through that. And then what we see is the individual dashboard here. So this is where an individual will see all sorts of information about their benefits, have the ability to apply for new benefits, report changes on their existing benefits, update information, close their benefits, all sorts of different things here. We can see this individual has some requests for additional information. That's what it looks like if we've sent a pen for additional information. It'll show up here. Then we can see down here, they've got a pending program for cash and medical assistance. Their current benefits that are active are SNAP benefits. We can see the amount they received for this month is $169. Additional benefits information about the SNAP program down here. They've effective beginning of this month. Their ongoing monthly amount. And then the child in the household was approved for medical assistance. So kind of skipping ahead a little bit for an individual who already has existing benefits. I'm going to go through that account creation process again for an individual that doesn't have benefits, show what that looks like, and that will lead us into the application for benefits process. Okay, so again, we're going to select individual because we're creating an account for an individual. We'll put in the first and last name. Create a username. And a password. We'll again go verify our email address. Click step 2 after we verified our email address, and we'll log into that account we just created. Sometimes we'll have to do one of these reCAPTCHA tools here. It wants us to select the crosswalks. And then once that's completed, we'll click verify. And we'll log in with the login we created. Proceed past this warning screen. And then we get again to the user verification. Grab a mock social security number here. So all the identifying information that I use in this presentation will either be like mock information that's been generated or fictional individuals. Okay, and then see, it happened much quicker this time. Possible address match. The suggested address is what USPS knows it by, the address we entered. You can choose either one. I'm going to choose the suggested address. Again, we'll complete these RIDP questions. We've successfully verified our identity, and with this individual, since this is a brand new individual to the system and they haven't applied for benefits, they don't have existing case in our system, it's going to drive us directly into the application flow. So we can see it's a similar view, but rather than being directed to the dashboard, we can see we're in an active application here. This is the application number. We can see it's currently 0% complete. As we proceed through the application, we'll make our way down this menu on the left side here, and this status will show the percent complete that we've gone through the application. So on this first page, just general information about applying for benefits in the One Eligibility System. Different links to details about the different programs that can be applied for. Different information about all the different programs. Click accept. And then it's asking what we're applying for. So the 4 options that we have to apply for benefits through this online portal is the SNAP program, Supplemental Nutrition Assistance Program, Cash Assistance, otherwise known as TANF, Temporary Assistance for Needy Families, Employment-Related Daycare, or ERDC, as well as medical assistance. And this is a number of different kinds of medical assistance. both standard Medicare, Medicaid, things like that. So we're going to choose SNAP, we're going to choose cash, and we're going to choose medical assistance. This is asking about getting local help. So for the medical program specifically, we have community partners and assisters available. If an individual is working with a community partner or is interested in working with a community partner to get help applying specifically for medical benefits, there's information about that here. And if we wanted to assign a community partner, we could choose yes here, and it'll give us the option to do that. We can enter the community partner's name and their organization, search for them, and assign them to the case. For the purpose of this presentation, we're going to choose no. And then this next screen is fairly similar, but rather than community partners, it is authorized representative. So we showed at the beginning that you can create an account as an authorized representative. That would be a trusted friend or family member who's going to help manage benefits and the application for benefits. So that may be somebody who needs the assistance in applying or in receiving their benefits. So they can be both an authorized representative, which allows them to help report changes, apply for benefits on the case, or they can also be an authorized payee, which would allow them to receive benefits, receive the pay on behalf of the individual who's being approved. So really important that if someone is setting this up, that it's a trusted friend, family member, things like that. And they can be added here and requested here, but it does require additional completion of additional forms and verification before that person is actually given access to anything on the case. So we could enter all that information here by clicking yes. But for the purpose of this application, we're going to choose no. So the first page we're going to reach in the actual entering information about our individual who's applying here is the household information page. And that's where we update information about the applicant as well as any other members of the household. So it's already going to take the information that we have about that first household member we set up the case for in the initial part of the presentation. So most of that information should be imported here. It's going to show the given name that we entered, but also give us the opportunity to update the name to something that the individual would like to use. So we'll say Linda prefers to go by Lynn. And you can see that gave us also access to this other drop-down menu here, which is going to allow us to choose if we would like to use Lynn on all of our notices and communication from the state, or if Linda's better. We'll say Lynn, and then we'll see throughout the application later when we come to sign the application or on any notices, it's going to show the preferred name that this individual has chosen. So it's asking about gender here. There's a number of different options. These questions have nothing to do with eligibility. It's part of our what we call Real D. So it's race, ethnic identity, language, and it's all demographic information that's taken and used for demographic purposes only. Gender modality, so not transgender. Is Lynn a migrant or seasonal farm worker? We'll say no. That is part of our expedited SNAP questions. We'll get to a page about expedited SNAP where we talk a little bit more about what that means. Is Lynn Hispanic or Latino? We'll say no. And Lynn's race, say Western European. And then we want to add an additional household member here. So we'll say add member, and it's going to open all of these fields for a second household member that we can complete. Say Luis is just about 2 years old. Identifies as female. Not a migrant or seasonal farm worker. Hispanic Latino, and also Western European. Is Louise living with Lynn? So we're going to say yes, but the answers to this question could impact benefits in a number of different ways. So certain benefits will require individual to be living with the head of household. Others, it can affect other benefits as well. So we'll say yes here. And then we're just going to add 2 members here, and we'll click next. Applicant information. If you've lost a household member recently, you may still have medical bills to pay. So this is asking about if there's any deceased household members or recently deceased household members, medical programs can potentially cover expenses with over the past 3 months. So again, if we answer yes to this, it's going to open a similar set of questions as we saw on the previous page with adding a household member. However, this is specific to anyone who has passed away recently in the household. So I'm going to say no for the purpose of this application and click next. That was it's a system issue that we need to get fixed. It shouldn't have shot an error there because we didn't actually fill out any information. So I'm just going to refresh that page real quick. And we'll proceed past this page. So just another program request screen here. Now that we have multiple people in the household on the application, we want to know which specific benefits that we've requested that each household member is requesting. So for this application, we're going to choose all benefits for each individual. But an example of where you may not do that is if they were applying for employment-related daycare for this child, you would only be requesting daycare for the child, not for the adult. Or, you can really request specific benefits for anybody that you want. Certain programs will require certain household members to apply together, but this is where the applicant will have the option to choose what they're applying for each person in their household. So similarly to that deceased household member screen that we saw, medical has the ability to cover expenses for up to the last 3 months. We call it, on our worker side of things, we call it retroactive benefits, but essentially covering any medical costs over the past 3 months for medical. So if we click yes, that's just indicating these individuals would be requesting retroactive medical benefits. Personal information. So again, this Social Security information was carried over from when we created the account for our first household member. And we can see here at the top of this window that we have 2 different tabs. So when on screens like this, where there's different information for different household members, we will have to click between the different tabs to provide that information for each household member. So we'll say Luis is also providing a Social Security number, which I will grab here. We'll say Luis is a US citizen, and then we're going to go back to Lynn real quick, and we're going to look at that citizenship question a little bit closer. So another thing to point out here, you may have noticed these blue question marks that pop up throughout the application. This is when we have an opportunity to explain a little bit more about what we're asking here. So if you hover over that and click and select yes if the individual was born in the United States or its territories, and that's all that's just more information about who would select yes for this question. Sometimes it'll be more details and you can scroll up and down if that exists, but this is just a quick blurb. So we're going to say no to demonstrate what that looks like for someone who may not be a US citizen. Does Lynn currently have DACA status, Deferred Action for Childhood Arrivals? Don't select yes if you would be eligible for DACA but haven't applied, or if DACA has expired. So we're going to say no. And does Lynn have one of these immigration statuses listed below? So all sorts of different potential immigration statuses that will affect eligibility for all of our different programs. One thing that comes up a lot here is the concern about people indicating that they're an undocumented citizen through our application. And the design of this is essentially that if someone were to answer no here, it's essentially not disclosing that they're an undocumented citizen. They're just, the only thing they're disclosing is that they don't meet one of these immigration statuses. So if anyone you're working with has concerns about that, we don't collect that information, and the system is designed to allow them to disclose what we need about their immigration status, but not have to specifically disclose that they may be undocumented. Rachel asks in the chat, does applying for benefits negatively impact someone hoping to gain citizenship? My understanding is it does not. And I will say the benefits are connected in to federally funded benefits, and Amber's answer about depending on the benefits is kind of what I'm getting at there. So the federally funded benefits can potentially have an impact, but that's about, yeah. James, I would follow James's link to get the exact answer on how that works for public charge. Excuse me. So back to the application, I'm going to choose yes here, and we're going to say that Lynn's current immigration status is lawful permanent resident. We'll say the date status was granted was January 2010. We'll say Lynn's from France. Has Lynn been granted legal protections under withholding of removal? Withholding of removal is an immigration judge can grant withholding of removal only in certain cases. If a person is likely to experience prison or worse in their home country, they may be eligible for withholding of removal. Anyone who might apply
Oh no. Andrew, you have frozen. So, James, you want to
I'm
be on?
gonna see what we can shoot.
Let's see. Andrew, if you can hear me, why don't you switch over to mute yourself first and then switch over to your telephone for speaking.
There we go.
Gone.
He'll probably need to turn off his camera is one thing we found too.
All right. Let's see what happens.
And while he's coming back, I was just going to put in the comments on the public charge thing. One thing I feel compelled to mention is that these policies are subject to change, although they can't be changed with the stroke of a pen. It takes some time, but they can change too. So we have to monitor what the policies are. All right, Andrew.
I'm so sorry. I lost power for a second. I'm trying to get my screen back up and running.
Oh
my. I'm on my phone here. This never happened during a presentation before, so I sincerely apologize. Give me just a moment.
While Andrew is doing that, I'm assuming people have heard concerns about immigration status more recently, or just opening it up.
Yes, we have had a few people that have a bit more concerns with immigration status.
I'll just add that some public charge changes based on every presidential administration. Oregon itself is currently a safe haven state and has been for well, my entire lifetime, which is only 18 years, as you know. And but that does not mean that our funds do not come from the federal government. So to keep that in mind, Oregon does not pursue people based on immigration status alone. So would not turn somebody over just based on their public benefit applications. And it will make a lot of sense to take that link that James put in and to check it every single time that a family asks you that question, not assuming that just because you knew today, you know tomorrow.
Yeah, I heard an account of how the sanctuary status passed. It was in the early 90s, a big bipartisan vote to support it in Oregon. And any comments so far on what you've seen? How many, I hope, I know one of the people attending, Ashley, is also a medical assistant, so a lot of this is familiar, but of course, we're including SNAP in this application. Hi, Ashley. And I'm just wondering if any of, for other people, if this is somewhat familiar, if you've helped someone over their shoulder type of thing as they have tried to apply, or at least this is opening that black box just a little bit to see what people go through when they do apply.
Well, I'll just share too. I have a very, 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 very large binder full of a million different resources. I've been doing Snap for over 6 years. I think I worked with James for quite a long time. And then the medical I've been doing for about 3 years. So if anyone ever has any questions, they can always reach out as well. If I don't know the answer, I know where to get it.
Yeah, that's my attitude as well. You can always reach out if you have questions. Because we know the clients you work with often need assistance. And these applications, we have two federal oversight bodies. We have Department of Agriculture at FNS for SNAP, and we have CMS, Centers for Medicare and Medicaid Systems. But and they have a lot of requirements, unfortunately. But it looks like Andrew's almost got where he wants to be.
I think we're good, and hopefully that doesn't happen again. Again, I'm really sorry. It's not really within my control, but I still feel bad about it. So it's actually kind of interesting, because now we can look at what happens if that was to happen to somebody and they're applying for benefits. We can see we're back at our dashboard here for that new account we created, and we have a number of unsubmitted applications. We have the opportunity on the right over here under action required to either continue or withdraw those benefits. So if we click continue, should bring us back to the last saved part of that application. So looks like we're on the medical bills and services. I'm going to, in the past 3 months, I'm going to go past that screen here. And we're back to the personal information screen. So again, we were saying that Lynn is not a US citizen, doesn't have DACA status, and is a lawful permanent resident. Does not have country of origin. France. And then immigration document type will say they have a permanent resident card, but there's a number of different options we have here. And then we have an option to enter the card numbers here. See if I can remember the how the card numbers work in the system. There we go. They have certain alphanumeric requirements for each different type of card number. There we go. So as you can see, if something's incorrect in the system or an invalid entry, it'll highlight that field as red, and you'll be able to amend that information. So we've entered this information here. As far as this application is concerned, this is what we'll enter, and then throughout interface process through a thing called verify lawful presence, as well as information and processes handled by our workers, will complete the verification of this during the intake process. Oh, and we need to complete Luis's information again. So yes, Luis is providing a Social Security. Let me grab that again. And Luis is a citizen. So as this loads, it will get rid of these errors here and move us to the next screen. Getting in touch with you screen, this is where we have contact information and preferred language information. So our household address is right here. When we enter the zip code, it'll populate the county here for us. If it was to be a zip code that's shared between multiple counties, the county field will be left blank, but it will it'll give the in the drop down the options of which different counties apply to that zip code that's been provided. Asking if the individual lives in Oregon and if they plan to stay in Oregon. Those questions are around what we consider residency, and residency is a requirement for a number of or all of our different programs, and the way that that's answered will depend on if they're eligible for benefits. So it's important to answer those correctly. If they pick up mail from a different address from where they live, they can choose this and provide a safe mailing address if it's not safe to receive mail at the address where they live. If we did that, it would open up a separate but similar field for mailing address. How would you like us to reach you? So notices will always be made available in the message center on this portal, but will also be sent through the mail unless we choose not to send paper copies of notices in the mail. How would we like to receive notices or an alert that a notice is available? So we can say paper only, paper and email, or paper, email, and text. So it's our cell phone. And then if an individual wants to receive texts, it's important to opt in, or what we call opting into receiving text messages from us. So if we select that button, we'll re-enter the primary phone number to receive text messages. And then we'll authorize to leave voicemails as well as email. And each time we make those authorizations, we have to confirm by entering that point of contact again. Communication needs. So an individual can select up to 5 different languages they may speak at home. So we'll say English and French because we said that Lynn was from France. What language does Lynn want us to communicate in person, on the phone, or virtually with them? This would be, say Lynn prefers to speak in French. So this would be an indicator when a worker sees this, that they would need to connect the individual with a worker who speaks French. If we have a worker who speaks French available, or we would need to rely on outside translation or communication services for that language. In what language does Lynn want us to write to them? So this is where, I don't know why it's not letting me select that on the first try. Apologies about that. So this is where an individual would indicate their preferred written communication. So notices that we send out to them, what language they want that to be in. Currently, we have Spanish, English, Russian, Vietnamese, Somali, traditional, and simplified Chinese. That is being expanded. We're working on a big project to expand it to a number of different languages. So eventually the goal is to be able to communicate in a written way with individuals in a way that works for them, no matter what their language is. If Lynn needed materials in an alternate format, we would select yes. And the alternate formats, we have large print, Braille, oral presentations, different types of data, like thumb drive, compact disc, computer disc, or audio tape as options. How well does Lynn speak English? Can indicate that here. We'll say very well. And does Lynn need or want an interpreter, captioner, or other accommodations for us to communicate with them? We'll say yes. And that will show that we have a number of different assistive options available, whether that's captioning, different kinds of sign languages, tactile or deaf interpreters. And if one is available, would Lynn prefer a bilingual employee? So I'm going to close this section here. Oops. This is just a notice saying that the language we chose doesn't currently have support for that language for our notices. So the notices will be in English. But as mentioned, we are working currently to expand that. French is going to be one of the first ones we expand it to, I believe, in the beginning of next year. So again, just verifying if we want to use the address as entered or the suggested address. Choose the suggested address. And then similarly, we'll have to enter contact information for other members of the household. We can, if they live in the same household, have the same contact information. We have this easy checkbox here that's going to just automatically display everything the same as we entered for the head of household. And similarly to the how would we like to reach you, it's going to have all the same information as the head of household. And then for communication needs, if this individual has the same communication needs as Lynn, we can just select that and it'll show all the same communication needs. If this individual has different ones, we can go ahead and change them. I don't know why it's doing that. It's something I got to make a note about. So we'll proceed on. And then disability demographics, this is the last part of real D, so race, ethnicity, language, and the D is disability. So again, these questions on this particular screen do not impact eligibility in any way, but they're asking about disabilities for demographic purposes. So is Lynn deaf or have serious difficulty hearing, blind or have serious difficulty seeing, difficulty concentrating due to physical, mental, or emotional condition, serious difficulty walking or climbing stairs, dressing or bathing, learning how to do things that most people their age can learn, learning their usual customary language, difficulty running errands alone, such as going to the doctor's office or shopping, or serious difficulty with mood, intense feelings, or behavioral control. We'll say no to all of those, and we have to answer again for the other household member. But for these questions are age-based, so since this individual is only 2 years old, it's only displaying a portion of those questions. Safety questions. So what this first question is getting at for cash benefits, would you like to talk with someone about concerns you have with your children? During the process of receiving cash in TANF, they'll work with a family coach. It's the worker they'll be assigned to, and this is kind of an indicator that we have some a need for some additional resources and additional support in areas such as child acting out, school problems, medical needs, or finding childcare. Will be a good starting point to indicate they may need referrals to some additional type of support. And these other two questions are safety questions. Do you need to get away from an abusive or unsafe situation? Or does your partner make you afraid by threatening, yelling, or physically hurting you or your children? So these are getting at, does this person maybe have a domestic violence situation that they're experiencing? And if someone had answered yes to these, we can't apply for domestic violence through this online portal here, but this would be an indicator that we need to have a safety screening with that individual or family and offer them the opportunity to apply for temporary assistance for domestic violence, which is another program that ODHS offers. And yeah, just kind of a screening point here for us to make sure that we're that since we can't apply for those benefits here, that we're not losing those folks and offering them that support if they need it. Expedited SNAP. So expedited SNAP is a requirement. If people meet certain requirements, it's a requirement on us as an agency to process that SNAP benefit within 7 days. And so if someone's income is less than $150 and they have no more than $100 in cash in bank accounts, if their total month income, cash or money in the bank is less than their total housing and utility costs, or if someone's a migrant or seasonal farm worker and has very little money, could all qualify them for expedited SNAP benefits. The actual benefit they receive is no different than regular SNAP. It's just a requirement on us to get those benefits processed faster for someone who has a higher need. So important to answer these questions as best as we can, especially for individuals who need help as quick as possible with food benefits. So say no here. Just to get through this screen here. And all that's going to do is kind of start the process on our end. Depending on what they answer, it's not going to change anything else in the application flow here. So since we indicated that Lynn is not a U.S. citizen, we have this question come up if Lynn has a non-citizen sponsor. So if we answer yes to this question, we will have an additional question: is Lynn sponsored by an organization? So this again will be information that's processed on the worker side of the application, but these are questions that are important to answer about if the individual has a sponsor and who they're potentially working with. Disability information. So it's asking if any member of the household is permanently blind or disabled, and this applies to both the medical program and can apply to work requirements in both SNAP and TANF. So if we're indicating that someone is blind or permanently disabled, we'll say who in the household is, and then once we select that they're blind or permanently disabled, it'll ask an additional question if any of these individuals are blind. So details about you and your household. This screen is an opportunity to request long-term care services. So some people may need help with activities of daily living like bathing, dressing, or live in a medical facility or nursing home, might qualify to get help for paying for these supportive services. Can include adults or children who need care for intellectual or developmental disabilities, and does not include children who only need help due to their age. So we'll say no for both of these household members. Household relationships. So again, this will impact who has to apply together within this household. So the question here, Lynn Belcher is Luis Belcher's parent. And a lot of questions that come up like this that both this and like tax filing information in the system that are relating to two different people in the same case will be dynamically updated in the system. So we can see when we go to Luis's page that since we answered that Lynn was Luis's parent, Luis Belcher is Lynn's child. Are you or anyone in your household unable to work due to physical, mental, or behavioral health reasons? If we answer yes, we'll indicate who that applies to here. We'll say no, but what this is getting at is for work requirements in both SNAP and the TANF program, if someone is going to be required to pursue a certain number of hours per month that they may need to meet for ABOD, which is a SNAP program, or work registrant requirements, or for TANF, there's a program called JOBS, which, you know, if someone's indicating they're unable to work, it would go towards helping exempt them for those programs. Tax filing information. So this is a medical question. So we'll say Lynn's filing as head of household, claiming Luis as a dependent, and will have the same tax filing status in 2025. And we can see since we entered on Lynn's page that Luis is a dependent, we can see that information has been dynamically updated here. American Indian, Alaska Native, and Tribal Lands residency. So this is asking a number of different questions about enrollment in federally recognized tribes or Alaskan Native regional corporations, and can indicate that someone may be eligible for tribal benefits, or that maybe they can be, if they're living on tribal land, exempted from the able-bodied adult without dependence program for SNAP. Living arrangement information. So Lynn Belcher will say currently lives in home, but there's a number of different options that we could put here, different kinds of living facilities, drug and alcohol facility, homeless or in a shelter, incarcerated, nursing facilities, things like that. We'll say in home, and same for Luis. Has anyone been released from prison or jail since the 1st of September? If we click yes, we would have an option to answer here.
Just want to take a moment to say one of the reasons why they ask about the jail and the prison is because it's a transition time, which means there's additional services that you're eligible for through Oregon Health Plan and other programs when you have that. So when you look at some of the health-related social needs links that I put, that transition population are folks coming in and out of jail or prison, and people who are having babies and things like that. So part of why there's those questions there is to help you qualify for more.
Great call out, thank you. So after that screen, we're on education and school attendance. So this screen can apply to a number of different programs. SNAP, if someone's a student of higher education, we would need to have them meet certain eligibility marks to be able to remain eligible for the SNAP program. If they are in the TANF program, it could count towards that their participation in the JOBS program. And for ERDC, folks in school can get daycare while they're attending school and taking classes. So for Lynn, we'll say that Lynn didn't finish high school, has finished 11th grade, currently enrolled in school. Education institute type is GED or high school equivalency. You can answer if they're taking courses online or not. And then these questions about when they expect to complete, what school they're enrolled in, and the enrollment type aren't required, but can help towards towards completing this information in the system, things that will be asked by a worker during the intake. So we'll say next June, and they're enrolled full-time. And this is one of the questions it's asking about higher education that would qualify them as a student of higher education for SNAP, asking if they've been placed in the program through the Workforce Innovation Opportunity Act. Or again, this also applies to the same if they'd been awarded federal work study. And then for Luis, it's going to default to no formal education because Luis is only 2 years old. And we could add additional school enrollment information if there was any, but we'll leave that as no. And that Luis did not stop attending school within the last 12 months. Household questions. So this is the first of a number of what we call gate post screens that we'll be reviewing. So it's got a number of different questions here that, if answered yes, will populate further screens in the application flow. So we will say that Lynn is pregnant. Any out-of-state benefits. So if there's been out-of-state benefits in the past 3 months, if someone discloses that, we'll need to verify with that state that those benefits have closed. Any tribal benefits that the person is receiving. Any SSI benefits. Has anyone in the household applied for SSI or waiting for a decision? Other benefits, which if we look at this tip here, we can see would be Social Security payments, SSB or SSD, veteran benefits, unemployment insurance, things like that. Accident or injury settlement money. Or sorry, not money. Accident or injury settlement information. Medicare details if someone's receiving Medicare, which will qualify for them for different types of Medicare related benefits that OHP offers. Felony details for food or cash benefits. If someone self-identifies as being a felon, it could disqualify them for being eligible for benefits. And then if someone would want to be referred to the WIC program, they can answer yes here. So since we answered yes to the pregnancy question on that gate post screen, it's now populated this pregnancy details screen here. So it's asking how many children is Lynn expecting from this pregnancy? We'll just say 1, but it could indicate it could be a multiple birth situation. We'll see the due date is January. And who is the parent of the unborn child? So it's displaying the other household member here. I don't think it should be displaying, this would most likely be if there was another adult in the household, is what you would usually see here. Or if it's a non-household member. If you choose non-household member, it's going to ask what the name of that person is. It's not a required question though, so if an individual wasn't sure or wasn't comfortable disclosing that information at this time on this application, they could just leave that question unanswered. And then, has this pregnancy ended? If you choose yes, you'll enter the last day of the pregnancy. And click add, and we should see this record added to this page. You can see now it's got this table here of the information that we provided. Resource questions. So another gate post screen here. If someone has any kind of these resources here, we'll answer yes, and it'll populate that screen later on. So if they've got liquid resources, which could be savings or checking accounts, stocks, bonds, mutual funds, all sorts of different things like that, you'd select yes, and then who has that. Owning and not leasing a vehicle, any life or burial insurance, prepaid burial agreements, burial space and merchandise, real property, life estate, annuities and trusts, loan and property agreements, qualified partnership policy and other resources. So we answered yes to liquid resources. So say that Lynn's got a checking account, only $100 in it. And you can indicate if it's jointly owned between multiple people in the household, or if there's any additional names on for anyone outside of the household. Our resource summary here will show any resources that we've added to the case. So we only added liquid resources. So that's all that's showing. And then the income gate post here, we have an opportunity to report one of 4 different kinds of income. We have earned income, which is one of our most common income types, wages, tips, in-home care workers paid by the state, self-employment, someone who files as self-employed on their tax return, owns their own business, unearned income, which would be Social Security, tribal benefits, unemployment. Unpaid work activity is not an income type, but that's where someone would indicate they're volunteering or doing job training. Specific income would be things like disability or workers' comp, Job Corps, child support is a common one that would be entered here. So we'll enter some earned income to show what that looks like. So we first choose the income category. We'll say it's wages from a job. The income type, once you select wages, could be a number of these different options. It could just be the normal wages they receive. It could be the tips, vacation pay, cash outs, depending on what that source is. We'll just choose wages. This is just the regular pay. So Lynn works 10 hours, paid monthly, gross amount that Lynn is paid for each pay period, $200. Did this question here, did Lynn's employment start prior to the 1st of September? If it's answered yes, we won't have to enter any additional information. If it's a recent job and we answer no, we'll enter the start date. And one thing that this can do is help prorate income correctly over a period of time. So let's say that this job just started, on the 15th of this month, and they received first pay. Is Lynn temporary away from this work without pay from this employer? If we say yes, we can enter reasons for temporary leave, when that leave started, and when they expect to return from work. Different kinds of leave reasons, maternity, medical, paternity. And if the employment has ended, we can indicate yes. And similarly, we'll enter an employment end date, date of final pay, and the reason that the employment ended. We add that income and we'll see, once it loads here, we'll see it in the table here. So the 200 wages monthly. If the individual wanted to add a new income record, they could select this link here if they had multiple sources of income for this same type of earned income. And then we'll see a summary of all the different types of income we have entered on the case, currently just showing the earned income that we entered. Expense information. So again, final gate post screen here where we have an opportunity to enter different kinds of expenses. So we'll say that Lynn and Louise have shelter and utility expenses, but they could also have medical expenses. This could be telling the department about your medical expenses could increase your food benefits or reduce the pay for long-term care services. Child support expenses, dependent care expenses, alimony, educational expenses, and deductions. So for shelter expenses, we'll say that Lynn's paying rent. $1,000. This utility included in this cost question is getting at what type of utility deduction the person is getting for SNAP. Utilities, but utilities is the interest. Is the electricity and gas that means yes. And these are getting at we operate um, uh, for certain utilities paid for SNAP benefits, depending on if they're the main source of heating or cooling, will count on the SNAP benefit application towards giving more benefits. So we can see the summary here that we've entered for shelter and utility expenses. And then annual income for medical, we take a look at both what's actually received in each month, as well as what's anticipated to be received annually. So based on what we entered on that income, those first income screens, we have a projected amount of $307 for the remainder of 2024 based on when we said that income started. Do we think it will be different than what is projected? We're going to say no, and then we'll see it populated in the expected amount, the same as what's projected here. If we said yes, that field will remain blank and we can enter what the actual expected amount would be. And then this is asking about the next year. So the income for 2025, if we assume that job is continuing, this would be the projected amount that the individual would be receiving. Oops, I didn't answer for Luis. So we're going to say all of this is the same as the projected amount since Luis is 2 and doesn't have any income. Employability screening. So this is something specific to the TANF program that is newly been introduced to this application process. So this is something that previously was completed during the TANF intake and will still be reviewed during the TANF intake with the worker, but now giving the opportunity to start completing it on the applicant, the application here in the online portal. So is Lynn looking for work? Say no. She's pregnant. Any help they would need before going to work? We'll say childcare. Has Lynn worked in the last 4 months? Yes. Any health issues that may impact their ability to work? We'll say no. Does Lynn provide care for someone with a developmental, physical, or mental health condition? We'll say no. And we're required to provide reasonable accommodations that we may need. Does Lynn need any accommodations to participate in the department's programs or employment? We'll say no, and then verify that we've read and reviewed and completed all these fields. And really what this is all getting at is the jobs program for TANF. There'll be an opportunity after they've been approved for TANF benefits to meet with their family coach and go through an engagement process to try and find ways to support that family through the jobs program. This is helping to start that conversation, but also depending on what those answers are, maybe finding a way to say that right now this individual is not able to participate in the program, or they would need these certain supports for them to be able to participate in the program. Child support cooperation. So the requirement here is to agree for the TANF program is to agree to cooperate with the Division of Child Support. On this page, it's just asking, in the pursuit of finding the absent parents or establishing parentage, are any of the following true? If they believe there might be harm to the applicant or the child, if the child was legally adopted by a single parent, or if the child is in the process of being adopted. If any of those are true, that would indicate we may not be pursuing establishing parentage or finding the absent parent. If we say no, then there will be the requirement to participate with the Division of Child Support. So it used to be in TANF that you would have to provide even more information to ODHS. The requirement now, like I said, is just to agree to cooperate with DCS. And when the Division of Child Support contacts you to work to proceed with that, you have to make if it hasn't been determined that there's good cause not to do so, you have to make a good faith effort to cooperate with them, or it could impact the TANF benefits. Healthcare coverage and benefits information, asking about different kinds of insurance or medical benefits that an individual may have access to. Access to health coverage. Can anyone be covered through employer-sponsored health plan who is not yet enrolled? So I'm not going too deep into those because medical policy is not my specialty, but it would be important to fill those out for folks who may have access to other medical programs. CCO choice. So when someone's applying for medical, their medical will be managed by a coordinated care organization based on where they live. There may be one or more coordinated care organizations available to them, and this is where they can choose who they want to work with. So for Marion County, they just have Pacific Source, so we'll just choose that. But I know like Multnomah County, where I live, there's I think 2 different options for folks to choose from, and different options around the state based on location. So we're getting towards the end of the application here. We can see 86% complete. Before we submit the application, we have an opportunity to review the summary of all the information that we put in here. So we can see who's in the household. We can review any contact information, what programs we've requested. And we can see these blue pencil icons on the right here. If we were to click any of those, it would bring us back to that information to further edit it before submitting the application. And we click next. So the next series of pages is going to be a lot of written information about different programs. So this is offering different resources and contact information for domestic violence, child support, child care, how to report abuse and neglect, things like that. Rights and responsibilities. This information will also be sent in notices to individuals who are approved for benefits, but this is important to understand both what your rights in ODHS programs are and what you're required to do, what your responsibilities are. Program acknowledgements, it's just different information about the programs the individual's applying for, is information about cash assistance, information about domestic violence assistance, talks about assigning child support rights, working with the Division of Child Support, and TANF time limits. So that should all be something that the family coach is hopefully going over with someone who's been approved for TANF, but an opportunity for an individual to read about it themselves there. Estate recovery, it's a program where people who got help to pay for long-term care costs may include federal government charges made to the state for Medicare Part D, things like that. If this is something that applies to the individual, there's contact information to find out more about that. And information about reporting changes. So just this is very limited. More of it will be program specific in the rights and responsibilities that they get, but just a statement that they're required to report certain changes. Penalties, it talks about fraud and things like that, and what the certain penalties for each program would be based on fraud or EBT card misuse, things like that. And then information for all programs about non-discrimination, how to reach out to the governor's advocacy office, what we do with the social security number, and information sharing. Veteran information. So this question is asking if there's anyone in the household who is a veteran or in current military service. This may qualify them for certain medical benefits. Voter registration. We're required to ask. If someone indicates yes, then we'll send them information about how to register to vote. And then finally, we should be getting to the sign and submit page. Just reading about what you're signing to here. And then once we get down here, we'll see we need the signature for the individual's name that they provided. We click that by entering the name below, we're electronically signing the application. And we'll click submit, and there's going to be kind of a submission process that happens here. It may take a minute or two, so this would be a good time if anyone's got questions, or if Amber or James saw anything in the chat come up that I or we didn't catch. We can have a quick chat about it while we wait for this application to process.
Amber put a ton of great resources that are available, but
I saw that. That was awesome.
yeah. That is a long application.
It is a long application, and I feel like I was maybe kind of speeding through the end there. I wanted to make sure we got through it, especially with the little interruption that we had. So it is a lot. It's a lot on people who have a lot, may have a lot of other things going on in their life to sit down for an hour and a half to put all this information out there. So yeah, hopefully this will be a good resource to kind of support individuals through that process and explain a little bit more about what to expect, and even just seeing how long it is, you can hopefully use that to kind of inform people and let them know, like, you're going to want to have as much as you can, a few minutes, some quiet time to make sure to focus on this, to get it all filled out as best as you can. That said, this is just the start of the process for everything except for what we call Magi medical. So certain medical benefits will be approved through this initial application process. Most of this will require an interview or further follow-up with the workers. So there is opportunity to ask questions directly with a state worker and to clarify things that may be unclear. But yeah, just trying to complete the application to the best of their ability.
And as a time check, we have 10 minutes left. Is that right, Amber? So-
Yeah, we have about 10 minutes. Has anybody walked this through with a family before, or is this something you've sent families to? Or I'm just curious about what the practice has been so far for folks. You've helped family, that's great. About just a thumbs up emoji on your thing to see, have you used this with any of the relief nursery families you worked with before? Nobody's used it. You've been asked about it. Yeah. Thumbs down. All right. Thumbs down if you haven't used it. I'm just saying if you're still alive out there.
I
It's
will
Friday
say,
afternoon.
thank you, Laura. We'll say that we're hoping, some people are not going to be able to work with a computer system like this and have to apply over the phone. But we want to encourage people to use a one account as much as possible because wait times will get longer in the coming months. Yeah, I agree, Kate.
Okay, so we can see the application submission was successful. No further action required at this time. So the next page we get to here is an opportunity to upload any documents that an individual might have. If they have that document on their computer, if they click browse, a file window will open here. And let's upload a PDF. We can add comments here and attach. Once that's attached, we should see a confirmation. It's taking its time. It says it's done its work for today. Cynthia is saying last time they applied, it was a paper application. This would be much better.
And Andrew, there was a question about the resources for victims of domestic violence. So I was going to say there's questions that flag it for workers, but to apply for domestic violence survivor benefits, you do have to talk to a worker.
Yeah, so those can be applied for on the paper application, can be applied for over the phone or directly by going into the office, not through this application here. So yeah, the department does have a domestic violence grant that we can help with. It's just not available to request that grant through this particular application. And then
Yeah,
a question, oh, sorry, James, go ahead.
I was just going to say the domestic violence cases are the highest security we have because we just do not want any more people that need to see it. So hence the different application procedure.
Mm-hmm. Yeah, and then just to follow up to Cynthia's question about child support, we're required that the person agrees to cooperate with Division of Child Support. They don't have to provide that information directly to ODHS anymore. And as Amber mentioned, if there's safety issues or other reason that someone may not be able to pursue that safely for their family, we can waive that requirement. And that's something that the family coach should be reviewing with each family who's receiving TANF. So we can see this document that I uploaded has been attached. I don't know what. I clicked on a link for Adobe. Didn't mean to do that. We can view it, delete it, or attach another document. See confirmation when we click next. A summary of what we uploaded here. Document upload has been completed. Next steps talks about what kind of proof we need, proof of identification, immigration documents, income. And if someone's been pended for that information specifically, they'll get a notice tailored to that request saying exactly what they need to provide to us. And finally, when we get through all of those screens, we're brought back to the individual dashboard here where we can see what the status of the programs is. So based on the information there, nothing was able to be approved through that that initial process for this case. So everything is still pending, and we can see pending agency reviewed over here. So this individual would then, receive messages through the dashboard here. They can see messages in the message center. For this case, since we're in a testing environment, nothing is going to show up there just yet. And unfortunately, kind of due to the interruption with my power, I don't think I have time to pull up another case that does have them. But in this message center here, we would see, once notices are generated, the ability to view those notices. And then way back at the beginning of the presentation, that first case that we looked at, you can see that when something specific is being requested from a case, that information is displayed first thing that you see when you log in to the dashboard. Oh boy, it's taking quite a while to navigate around here towards the end, so apologies about that. But yeah, currently no messages here, but we would see messages in the inbox and be able to open, view them, save them to our computer, print them. And then I think just I'll mention two more things that I find super helpful. This down here in the right corner is our chatbot tool. So it's an automated tool that has answers about our programs and navigating the website preloaded into it. So if someone is having issues, or you're helping someone who's having issues get through the application, we can pop that up, try to figure out answers that way. If it's something that the chatbot can't answer, it'll direct you to phone numbers that you can call to get answers. So that's a great tool to use. And then once someone has been approved for benefits, we have another great tool for managing those benefits. We have a mobile application that we can use, for existing cases that are active or pending, to view information about those cases. One kind of disclaimer I will give about that is it's a fairly new technology, and we don't currently have the ability to do this whole application process on that. So it's important to remember that it's really a tool for managing benefits once they've been approved, but it can see benefit status, view notices there, upload documents there, as well as view and print the verification of benefits. I know those are important for accessing other community benefits. Once someone's receiving benefits through ODHS, they qualify for other benefits. So that information can be received both here online as well as in our mobile application. So that's available on Apple and Android application stores. So I think we're reaching the end. So I'm gonna wrap it up and turn it back over to Amber.
I like that Zoom now tells me that I'm talking to myself. I'm gonna